A warm welcome to everyone. In today's lecture, we are going to learn about the objectives of suturing and about the classification of suture materials. I am Dr. Devapriya Appukutan, Professor in the Department of Periodontics, SRM Dental College, Ramapuram campus. So following periodontal flap reflection and debridement or following harvesting of free gingival grafts or connective tissue grafts, there is a need to suture the flaps or to suture the graft onto the recipient site. So we need to know what are the objectives of suturing. So the primary objective of suturing is to maintain hemostasis and then to provide an adequate tension of wound closure without leaving any dead space, but the tension should be loose enough to prevent tissue ischemia and necrosis. Next objective of suturing is to permit primary intention healing. Then the objective is also to reduce post-operative pain. Then the other objective is to support the tissue margins until they have healed, until the support is no longer needed. Then we also place a suture to prevent bone exposure that could result in delayed healing and unnecessary resorption. And we also aim at proper flap positioning. Next, we go to the principles of suturing. So when we start suturing, the sutures should be placed first distal to the last tooth and in each interproximal space, and the suturing should continue in a mesial direction. The suture should always be inserted through the more mobile tissue flap first. And in the case of dentistry, a circular form of needle is mostly used because of the restricted space in the oral cavity. Then the suture needle should be grasped only by the needle holder, and the suture needle should be inserted and pulled through the tissue in line with the circle. And when penetrating to the tissues, the needle should enter at right angles to the tissue. And then when you pull the suture, pull it tight enough to secure the flap in place without restricting the flap's blood supply. Then the flap should not be blanched when tying a suture. The knot should be placed 2 to 3 millimeters from the suture line. The completed knot must be tight, firm, so that slippage will not occur. The knot should never be placed on the suture or the incision line. The suture material should be cut 4 to 5 mm away from the knot. Now we go to the classification of suture materials. Based on the material of origin, suture materials can be natural or synthetic sutures. On the base of the structure, they can be monofilament or multifilament sutures. And basis on their absorbability, they can be absorbable suture or non-absorbable sutures. And based on their coating, they can be coated or uncoated. And based on their usage, they can be orthopedic usage, cardiovascular usage, cosmetic usage, etc. First, we will see about the suture materials based on their origin, material of origin. They can be natural or synthetic. Natural suture materials are derived from animal or plant sources. They are less frequently used. Why they are less frequently used? Because they tend to provoke a greater tissue reaction. Next is synthetic suture materials. They are comprised of artificial fibers like nylon. They tend to be more predictable than the natural sutures, particularly in their loss of tensile strength and absorption. Next, we see about the sutures based on their structure. They can be monofilament or multifilament. Monofilament, as the name denotes, it is a single-stranded filament suture. They have a very low infection risk, but also have poor knot security and poor ease of handling. Multifilament sutures are made of several filaments that are either twisted or braided together. They handle easier and hold their shape for good knot security, yet can harbor infection. So when we look at the suture materials and their absorbability and their structure, for instance, vicryl is absorbable and it is multifilament. PDS is absorbable and monofilament. Monocryl is absorbable and monofilament. On the other hand, nylon and proline are both non-absorbable monofilaments and silk is non-absorbable multifilament. So this picture shows the structure of a monofilament, multifilament. And in the case of multifilament, you can see the difference between twisted and braided. And these suture materials, monofilament or multifilament, can be coated or not coated. So let's see the basic difference between monofilament sutures and multifilament sutures. First thing we need to know is memory. What is memory? The ability of the suture to return to its original shape after its deformation by time. Monofilament sutures, they have a very high degree of memory. So they are very stiff, difficult to handle. The knots are less secure and need extra throw to prevent loosening of the knot. Now let's see the difference between monofilament and multifilament. So in terms of memory, monofilament has very high memory, so it's difficult to handle. Multifilament is easy to handle. Monofilaments, they cause less tissue drag or tissue trauma, whereas multifilaments, they cause more tissue drag. The monofilament does not wick, whereas the multifilament undergoes wicking effect. So what is this wicking effect? It is nothing but the multifilament sutures allow the fluid to penetrate the body through them from outside, which can lead to infections. Next, we see about the knot security. Monofilaments have a very poor knot security, whereas multifilaments have good knot security, necessitating less throws. Monofilament has less tissue reaction, whereas multifilament induces more tissue reaction. Now, going on to the classification of sutures, based on their absorbability, they are classified as absorbable, non-absorbable. The absorbable sutures are further classified as synthetic, natural. Non-absorbable is further classified as synthetic and natural. So, first let's see about the absorbable natural sutures. The term absorbable refers to the fact that they can be absorbed by hydrolysis. So under absorbable natural sutures, you have collagen, plain surgical cut, fast absorbing surgical cut, chromic surgical cut. Under absorbable synthetic sutures, you have polygalactic 910, which is nothing but your vicryl, polycaprolate, polysop, maxon, polydioxanone, and VLOC. And next, coming on to the non-absorbable natural sutures, we have surgical silk, surgical cotton, surgical steel. Under non-absorbable synthetic sutures, we have nylon, polyester fibers, polybutester sutures, coated polybutester suture, polypropylene, and Surgipro 2. Thank you so much.